I'm talking about the systematic review, and yesterday we have a presentation about systematic review here, and I'm just presented or trying to highlight this is a tool that we can use in our research as an alternative to the scientific research or the lab research. This is an office research. It is not an easy, but it's an office research rather than a lab facility research, which is difficult and maybe unavailable in our situations. I'm going to outline the what is a systematic review, the importance of systematic review, what the difference between systematic review and narrative review and the meta-analysis, and the steps of performing this review. And finally, we'll do a critical appraisal for a systematic review. Medical research in general are either primary medical research, which could be basic research, trials, clinical trials, or epidemiological trials, and with different and the huge numbers of subtitles of this research. And this is the primary research. And based on this, we can do the secondary research. So if we took the data from this basic research, trying to analyze these data, this will be the secondary research, what we call the office research, which is either a narrative review or systematic review or systematic review and meta-analysis. Systematic review provides a comprehensive critical appraisal and synthesis of pertinent research studies on specific issues. Systematic review is the result of a planned methodological approach to searching for pertinent literature and sensitizing highest quality information from clinical studies to answer specific questions. Systematic review is more than a summary of data. It is a systematized way of research. In terms of level of evidence, we can see this is a pyramid of level of evidence. We can see that randomized control trials, which is the most top one of these of these studies. On the top of these top studies is the systematic review. So systematic review come on the top of the research pyramid as evidence-based medicine. What is the difference between review, systematic review, and meta-analysis? These titles here summarize what is a narrative review. So narrative review is a summary of selected literatures, theoretically describe and or discuss current state of science. It covers a wider range of issues, broad and qualitative general questions, not specific questions, do not follow specific methodology, no inclusion or exclusion criteria, potential for bias, and conclusion are not evidence-based. So this is the narrative review. And the systematic review is the opposite to all these points. Systematic review answers a defined research question by collecting and summarizing all empirical evidence that fits specific eligibility criteria. Then come after that the meta-analysis. If we just use statistical analysis to summarize the result of these studies, now it is meta-analysis. So summarizing the result of the research that we done, the systematized research we done, is a systematic review. Using the statistics to analyze this data, this is the meta-analysis. And systematic review may seem easier and simpler to perform than designing and implementing a clinical research. No, it is not like this. Do not underestimate the time. Usually give attention to the details, and focusing are highly needed to plan and develop a high quality systematic review. Not all systematic review are alike. You have different systematic review. This is show how they are different. At the base, if you just review a case control studies, this is a level 3. And if you review a cohort study, this is level 2. But if you're reviewing a randomized controlled trials and you're doing a meta-analysis, now you are at the top of the evidence-based medicine. Now I'm going through 10 steps of how to do or how to perform a systematic review. It's not easy, but we will try to make it more or less easier. This 5 and this another 5 steps. The first step is to develop your rationale. المبرر بتاعك انت بتعمل ده ليه. Is there a need for a comprehensive review of evidence? This is an important question, why it is needed, and what is the purpose of this systematic review? How will be it used for decision making? This is very important questions you have to consider before initiating your systematic review. The second step is to put your topic. How an intervention may be linked to the outcome of interest. This is an important question when you're choosing the topic. And if you studying or researching on diagnostic testing, what is the clinical decision-making pathway? You're using X-ray or MRI to reach to the diagnosis. So how to manage this? What other tests that can be used? And what's the next step for all possible outcome for doing this test? The most critical part of systematic review is asking the right questions through the specific topic. If clinical questions addressed are of little consequences to the patient or to the providers, the review will have marginal clinical utility. So have a good questions to make more interested for the patient and for the doctors as well. Then determine if this review is registered or not. And if registered, how this review is different from the other one that is registered. And what is the gaps would it cover in the evidence will add to the previous review. And then you go to the design the appropriate protocol. You have to look at the context of the research, the rationale of the reports, and the timetable for completing this systematic review. Use the BICO table, and BICO table is important, especially you have to add to the BICO table the inclusion and inclusion criteria of the research. And this is how to see that the BICO is an acronym to help you remember the component of focused research. So both this BICO table, which is including the patient or the population, the intervention, the comparison, and the outcome, with all these points in your mind through doing the research. The other step is to search strategy and database. You have to look how you're going to research for this data using the available database system like the Cochrane, Scopus, PubMed, etc. And the procedure of study selection and procedure for resolving this disagreement. You have to put some procedure selection of the research, starting by the titles, then by the abstract, and finally by the full manuscripts. This is the procedures. And in case of disagreement, why disagreement? Because usually the research is done by two persons independently. You start at the same time and you end at the same time independently, and you're doing the research, and when they finish, they sit together and see if there is discrepancy or not. And if there is discrepancy, you have to resolve this. And this process diminishes the bias. Data abstraction is very important, and then critical appraisal of the method you're doing, and you identify and management of any conflict of interest through the process of producing this review. In order to register your protocol for systematic reviews, there are various registry available on the internet. I will show you one of them now. Anyone can register his protocol. The importance of registration is to establish that you are doing this review. Establish that you are doing this review. Number one, they have to know that someone is doing this review. Number two, increases the potential of communication with interested research, and the communication with others might be someone find your research interested and they can collaborate with you. And reduce the risk of multiple review addressing the same questions, so as not too many people doing the same questions. And finally, provides greater transparency when updating a systematic review. This is one of the systems where you can register your review. And the coming step is that to perform a comprehensive literature review. It has to be structured and systematic search, as we said, and going through different databases would have to be defined, and you have to define the inclusion and the exclusion criteria, and define the keywords that you're looking for, and you have to use the BICO as well, and in order to identify relevant publication in for the inclusion in your study. So this is how to use or how to do a comprehensive literature review. And then based on the established criteria and the methods you outlined on the protocol, so you select your study, and based on the exclusion and exclusion criteria, and as also based on the keywords that you settled. And then you go for extract the data and perform the analysis. This is the final step or pre-final step still. So you have to extract your data from starting from titles, abstract, and then manuscripts, and then you perform your analysis after that. Then you assess the level of evidence. As we said, not all systematic review are alike. So we have level 1, level 2, level 3. And then finally, you report your data. You report your data or the drafted data that it is transparently documents the process of followed during doing the research, and report the result in a clear and concise manner. This is a source of what we have said, the source of data that we have described. And this is the final step, which is the critical appraisal. This table you have to use after finish your work and look at each of these titles and say yes or no based on your research, if you included this point in your research and you fulfill it or not. Because if you fulfill it, this point, now you have a good critical review. But if you don't follow any of these points, so your review is not okay. The message from this presentation is to show that systematic review is an evidence-based medicine. It is the top of the research. It does not need lab facilities or even fund to doing lab research. It is feasible for developing countries with lack of lab facilities, and it could be an access to a Q1 journal. And thank you for your time, and go and publish.